Hello, and I'm Glen Macnow. Welcome to Ask the Doctor. Joining me today, Dr. Jeffery Carpenter, Chief of Surgery here at Cooper University Healthcare and Vascular Surgeon. Dr. Carpenter, pleasure to meet you.
Nice to meet you, Glen.
You're going to answer some questions that people have submitted on carotid artery disease. So let's really just start with the basics, which is what are the carotid arteries, where are they, and what do they do?
Right, good question. Well, we'll start at the heart. The heart is the pump where all the blood comes out and is circulated to the entire rest of the body. The main artery that exits the heart is called the aorta. And one of the first branches off of the aorta is called the carotid artery. So it's the main pipe that goes up to the brain and gives the overwhelming majority of the blood to your brain comes from those two arteries. So they're very important.
So how does carotid artery disease occur? How does that happen?
Yeah, carotid artery disease is almost always the result of hardening of the arteries, or atherosclerosis, which is the same thing. These are the same kind of diseases that give you heart attacks, because when those arteries become too clogged with plaque and cholesterol and calcium debris, the arteries can't supply proper blood to the end organ, be it the heart for a heart attack or the brain, which causes a stroke.
Well, you took me where I want to go with this, Dr. Carpenter, which is high cholesterol and diet, and how much of a factor is that?
Yeah, high cholesterol is probably the second most common cause of hardening of the arteries and atherosclerosis. The number one is cigarette smoking. So people like to talk about cholesterol and diet, but they'll be smoking a cigarette at the same time, and that is, 100 times more powerful than a cheeseburger or that strip of bacon. Cigarette smoking is the overwhelming cause for most atherosclerosis and the most important risk factor. Now there are some other things, we can't pick our relatives, right? Mm-hmm. So bad genes predispose people to hardening of the arteries, atherosclerosis. But I really want to get the point across that cigarette smoking is the worst culprit here.
Stop smoking.
Yeah, and it's the same story, whether we're talking about the brain and the carotid arteries and stroke, or whether we're talking about heart attacks. There's a lot of discussion now about PAD, people that get cramps in their legs when they walk. It's all the same disease, just in different arteries.
Okay, all right, that's number one. Any types or demographics of people? You mentioned heredity. Are there any demographics that come into play with vascular issues?
It really is more prevalent in men than women, although you can make that up very quickly with cigarette smoking. Mm-hmm. And it's of course an older person's disease. You don't see many kids with atherosclerosis and hardening of the arteries. So elderly smokers, male a little bit more than female.
What are the symptoms that somebody might be feeling if they're starting to develop this?
Well, probably none. Carotid artery disease is overwhelmingly asymptomatic. So it's kind of a silent disease, and the first warning that you have it could be a major stroke. And most of my patients would tell me that there are some things that are worse than dying, and their fear of having a stroke is one of them. So it's important that if you have those risk factors, that you be screened for this disease, because it won't be necessarily apparent by symptoms.
Dr. Carpenter, I know we've kind of gone over this a little bit, but people submit questions, and somebody wants to know about family history. They said, my mother had a blockage in her carotid artery. It's something that I worry about. I'm almost 60.
Yeah, so we did say a couple of minutes ago that genetics and family history is important for development of vascular disease, atherosclerosis, and it is. I wanted to add to that last answer, though, a little bit, because while I said that most people are asymptomatic, there are some very important warning signs, symptoms of carotid disease if they're causing a stroke, and those are things to be aware of. You can just pass out. or have a lot of dizziness or lightheadedness. You can temporarily lose your vision in one eye. That's a warning sign of a stroke and a symptom of carotid disease. You could temporarily find yourself unable to speak, and that's a warning sign of carotid disease and a warning sign of stroke. You could lose control or suddenly become numb or unable to feel an arm or a leg or part of your face. Those are the most classic warning signs of a stroke, and they can come and go, and if that happens to you and you're fortunate enough that it doesn't come and stay permanently, you should definitely not ignore it and think, oh good, I'm glad that's over and I don't need to do anything about it. That's your chance.
Yes, I was blinded in my eye for one day, but now I'm okay.
That's right.
Yeah, get to the doctor.
That's your chance to get it checked out and head off what is a warning sign of what could be a major disabling or even fatal stroke.
We talked about smoking, we talked about diet. Let's talk a little bit about exercise. How important a role do you think that plays in preventing or in treating vascular disease?
Yeah, we know that exercise is definitely great for the cardiovascular system and is good for helping keep cholesterol down and keeping your heart fit, keeping the juices flowing. I say I'm a poster child for it. I exercise every single morning of every single day. I run a couple of miles before I come in to work. I'm a strong believer in it. It's not because I love to run, it's because I totally believe in it as an important part of cardiovascular fitness and stroke and heart disease prevention.
And your knees have not betrayed you either, huh?
Not yet.
There
Not
you go.
yet.
Well, good luck with that. That's where I lost it, in my knees. Once a person is diagnosed with carotid artery disease, how is it? Let's talk about the treatment options. What's typical there?
Yeah. So there are medical treatments and surgical treatments for carotid artery disease. So I think the most important message to get across today is the importance of risk factor management. You can't change your genetics. You can't change who your mom and dad were. The things that you can modify to decrease your chances of stroke and carotid disease are first and foremost, have I said this before? Not smoking cigarettes.
I believe, hold on. Just so we get this across.
Yeah, so not smoking.
There we go.
That's number 1, 2, and 3. Next is keep your cholesterol under control. And some people can do that with diet. A lot of people, especially with the American diet, will need help with some medications called statins that are cholesterol lowering medications and are very effective at reducing the cholesterol, preventing heart disease, preventing stroke. So keeping the weight down, daily exercise, all these kinds of lifestyle modifications are very important medical treatments. And of course, watching your diet.
Can my, this is a question somebody submitted, it's can my primary doctor manage my disease? When do I need to see somebody who specializes in treating carotid artery disease?
Yeah, the primary doctor is probably the best person for managing, your high blood pressure, getting your cholesterol under control, deciding whether or not you're somebody that should take a daily aspirin. Again, another thing that helps particularly with prevention of stroke and heart attack if you're in the appropriate categories for that. And the primary doctor is very well attuned to that kind of regulation of medications and recommendations for weight loss, diet, exercise, and is the perfect person to do screening to see if you're in the categories that ought to actually have an examination, which might include an ultrasound to take a look at the carotid artery and see if it has a buildup of plaque.
You recommend everybody over, I guess, whatever age, get an annual physical, blood work, the whole thing?
Yeah, I think that's important, especially with a large proportion of the American population being obese, inactive, sedentary. I think that's very important, especially as we age.
and no smoking. This question, if I have surgery to unblock one of my carotid arteries, what is the likelihood that I will need it again down the road?
Yeah, let's talk about that. We talked about medical treatments for carotid disease, but really what those can do is stabilize plaque that you already have so that it doesn't get any worse. But there is no drain cleaner that we can give you in the form of a pill or a drink that's going to dissolve that plaque and get rid of it. It's a mechanical blockage in the pipe, and what it does is two things. One is it constricts the artery to restrict the amount of flow, but the other thing, and this may be even more devastating, is that the little bits of debris in that big clog in there can break off, and then they go downstream, and where they travel is right up into the very small arteries up in the brain where they eventually get wedged. And everything behind that wedge, boom, gets no blood at all, and it dies. And that's what causes the stroke. So two ways to cause a stroke. One is restriction of flow, but the more common is breaking off of bits of debris. So the blockages, fortunately, if there is a fortunately, are usually located not up inside your brain, but in the carotid arteries in your neck, which are accessible to surgeons like me, where we can do an operation where we make an incision in the side of the neck. The artery is right under the skin. If you push on the side of your neck, you can actually feel it. Open that artery up, scoop out the blockage, and then close that artery back up again. Takes a little over an hour to do that procedure. You stay overnight in the hospital and then go home the next day. There's also a treatment from inside rather than through an incision that we can treat carotid artery disease by angioplasty and stenting, just like for blockages in the heart arteries. We can go in through a pinprick in the groin, thread a wire up through the blocked artery, snake a balloon over that wire to dilate the artery open, put a stent in there to prop it open. A stent is a metal cage that keeps the artery expanded, and that takes about the same amount of time. You also stay overnight. You also go home the next day. So those are the two options, and your surgeon can help you make a decision which of those treatments is most appropriate and most durable for your particular situation.
Well, we're here at this terrific facility at Cooper here in Camden, and I know that the operating rooms have been updated for minimally invasive procedures. Can you tell us about that and what sets Cooper apart from other hospitals in the area in this regard?
Yeah, Cooper was the first hospital in New Jersey to have in its operating room a full angiography suite. So my colleagues and I who practice vascular surgery here work in a very modern and beautiful operating room where we can combine the percutaneous procedures like I was talking about with the angioplasty and stenting with traditional open surgery, and we can do a little of the minimally invasive combined with a little of the traditional surgical procedure to work together to get the least invasive and most durable effective result for our patients without having to choose whether to do it all with traditional surgery or all in a minimally invasive approach. And that's possible because of Cooper's investment in hybrid operating rooms, they're called, and we're very proud of those and do great work there.
Well, I want to thank everybody for their questions. Dr. Carpenter, I want to thank you so much for your time and your expertise. To learn more about the vascular program at Cooper or to see other videos in our Ask the Doctor series, visit cbsphilly.com/CooperDocs.